Now, with more than 45,000 Indian nationals living in the 4 Ebola-affected West African nations, India's airports are on alert, and the government has opened up an emergency helpline as part of measures to tackle any outbreak of the deadly Ebola epidemic. Remember, the illness has already been declared as an international health emergency by the World Health Organization, and authorities across the world have voiced fears the virus could spread worldwide.
An intensive surveillance to prevent the spread of dreaded Ebola virus in the country. While Health Minister said there was no cases in India, the ministry is taking no chances. The government has already initiated some measures to prevent the disease from entering into the country, which include tracking of passengers arriving from the affected countries at the airports. In Mumbai, isolation wards are being prepared in case of any cases. The government has advised Indians against non-essential travel to the 4 West African countries such as Guinea, Liberia, Sierra Leone and Nigeria, which form the epicenter of the disease.
In Bangalore, the Rajiv Gandhi Institute for Chest Diseases has been the hospital that the Karnataka state government has designated in case they find even suspected cases of the Ebola virus in terms of patients. They'll be brought straight here. After the screening in the airport, the patient will be referred to this hospital directly. There is a special quarantine center that we stand here right now that has been made a little away from the hospital, but especially for these patients. And in terms of the arrangements that have been made, you can see that the wards are already ready. Till now, not a single case has been reported. But what's most important is the preparedness. I'm here joined by the director, Dr. Shashidhar Mukhi. Sir, the most important question I'd like to ask you at this point of time is the preparedness. Medication and in terms of also protection. Medication, let me start. Do you have any cases and do you have any medication ready?
At present, we have not received any cases, and for the last 1 week, all arrangements have been made. And this arrangement, we are doing it regularly for the last 10 years. When H1N1, when SARS was there in 2003-05, and avian flu, and then coronavirus, MERS coronavirus, and now we have got the. So a separate block has been identified, and all the time that preparedness is there with us.
Besides this, all air passengers arriving in India from Ebola-affected countries must now fill in a symptom checklist form and provide addresses as the government builds a database to track people who might develop symptoms. With Srisha, Indra and Devakar, Bureau Report, Headlines Today.